Welcome to Integrity Linguistics Institute. What does Dr. Sands suggest about pain in a missing or phantom limb? Before we proceed further, what is the meaning of phantom? Does anyone know what is the meaning of phantom? It's
False pin? False pin?
could you please repeat?
False pin.
Whole spin.
False. False.
Salse.
False pin.
Falsely.
Patient.
Falsely. Okay. This is right. FALSE, right?
Yes, sir.
Okay, good. Okay, that is like 99% the correct answer, right? Well, very nicely done. Okay, so phantom actually means, something that is not existent. So again, it is something that is not true. Okay, or in usually it is, meant for ghost. Actually, this is the real meaning of phantom. Like ghost, so ghost basically means what? Ghost is something that is not true, means it doesn't exist. So it is, it is a false existence, right? So phantom basically means ghost. Now, they see there is certain things called, like, there is a medical condition called phantom pregnancy. Phantom pregnancy basically means what? The person is actually not pregnant, but the body feels as if it is pregnant. Okay, it is a false pregnancy, but there is actually no pregnancy. Again, so this is what we call as a, phantom. Okay, phantom basically means exactly like just Reena said, that is something that is seems to exist. It seems to exist, but does not exist. Right. It seems to be true, but it is actually not true. It is false. Right. So this is the meaning of phantom. Okay. Now see, phantom limb. Phantom limb basically means what? The person actually feels like there is a limb. Limb basically means arms or legs. It can be arm or legs. Limb basically means arms or legs. So phantom limb. Phantom limb basically means there is no limb there. There is no leg there, but the person still feels like there is a leg. The person still feels like the limb is existing, but in reality, there is actually no limb. So, see, pain in a missing limb. Now, see, over here, is it possible for a patient to feel pain in a leg that is not missing? So, imagine that, David over here, David's right leg got amputated. Just suppose that right leg got amputated. So that means the right leg is not there. So if the right leg is not there, is it possible for the patient to feel pain in his right leg? So the patient is telling, I am feeling pain in my right toe. You're looking into the patient does not have a right toe, but the patient is feeling, I'm having pain. Right now, you see, this is how sophisticated the language in OET is. So this is where you need the right training over here. Okay, so here the question is asking you, what does Dr. Sands suggest, okay, about pain in a missing limb? So the patient is feeling pain in a leg that is not there. Okay, so that is okay. So that is the question over here. But what is your duty here? What is the stem of the question? What is the question stem? The question stem is to identify the suggestion of Dr. Sands. This is the suggestion. They are not asking you what is the meaning of phantom limb. They are not asking you about the pain in a phantom limb. They are asking you what is the speaker. So the speaker is Dr. Sands. What is Dr. Sands suggesting? Right? So here this person is going to suggest one particular thing, a recommendation, a suggestion, okay, an opinion, or we can say. So you have to listen very carefully for the belief system of Dr. Sands. So according to Dr. Sands, what opinion does she have about people suffering pain in a missing or phantom limb? Right. So this is what the question is asking you. So like this, you have to identify the keywords. You have to, link the keywords together, and you have to identify the question stem. All these things happens only if you read the question with high quality. Right. So let's read answer option A. Underreporting by patients makes it hard to know how frequent it is. Okay, so under reporting means no one is reporting. Okay, over reporting means everyone is reporting. Under reporting means no one is reporting. Under reporting by patients makes it hard to know how frequent it is. All right, so before we go a little bit further, tell me what is this it referring to? So we have this two tiny words. What to which information is this it referring to? Can you tell me? Type your answer in the chat box, or if you want, you can unmute yourself also. Underreporting by patients makes it hard to know how frequent it is. Okay, so here the important it is this one. So this is the it that is more important.
Pain, sir, pain.
Okay, all right. So what does Dr. San suggest about pain in a missing limb? Okay, yes, that is indeed the right answer. Okay, so here you have this it is basically the pain in the missing limb. Okay, so see, it is basically a pronoun. So we can say it is basically a pronoun. What is it doing? It is basically replacing one information. It is replacing one info over here. So that what information is being replaced? This information, pain in a missing limb. Okay, so if they want, they can write like this. Okay, makes it hard to know how frequent pain in a missing limb is, but they want to confuse you. So they use, pronouns like it over here. Okay, so good, very nicely done. Now let's take a look into answer option B over here. So let's see what is answer option B. Answer option B is telling the discomfort can generally be traced to a physical cause. Okay, so here discomfort basically means pain. Same thing. The discomfort can be traced to a physical cause. So this is the suggestion over here. So these A is a suggestion, B is a suggestion, C is also a suggestion. The problem affects far fewer patients than in the past. Okay, so affects. So what's the tense over here? Affects is basically present tense. The problem is affecting. The problem affects. So it is present tense over here. Far fewer patients than the past. That means in so many patients were suffering from pain in phantom limb, but presently, that is currently only very few patients. Compared to the past, only very few patients are suffering pain. Okay, that is the meaning. Okay, so that is the meaning of answer option C. But for us, in today's session, answer options are not very important to us. When I come across very interesting answer options, only I'm explaining it to you. Here, the main duty is the question. So here the question is, what does Dr. Sands suggest about pain in a missing or phantom limb? So here, what is question is this, and what should you listen in the audio? Should you listen for the patient's emotional reaction, the expert opinion or explanation, description of a physical symptom, or a treatment method? So again, you have to ask yourself, what does Dr. Sands suggest about pain? And what should I listen to? So when the audio is going to play, what should I listen to? What should I give more importance? Is it going to be A, B, C, or D? Okay, so we have answer option B over here coming. All right, so I want maximum participation. It doesn't matter if your answer goes wrong. Okay, so we have to be extremely comfortable making mistakes. What should you listen to? What is the duty over here? All right. So let's see what the answer option is. The correct answer is B, expert opinion or explanation. You see, what is the stem of the question? Suggestion, right? So Dr. Sands is suggesting. See, for example, all of you are medical experts. All of you are medical experts. So would you suggest a person to, if they are experiencing a bacterial infection? Okay, would you suggest them to go and seek Ayurveda or homeopathy or some those kind of medications? Like if they're having a very serious medical bacterial infection, would you suggest anyone? No, right? Because you are knowledgeable. You know how important antibiotics are when treating complex bacterial infections. So because you have that knowledge, you have your belief system, you know what is right, you are giving them an opinion. So you're telling them, see, you are having a very serious bacterial infection. Okay. In my opinion, I strongly suggest you to go to a doctor and get antibiotics. Right. So that is the suggestion. So suggestion is an expert opinion, right? So here, when you're going to listen to the audio, you have to tell yourself, okay, Dr. Sands is giving an expert opinion, or she is giving her a suggestion about people suffering from pain in missing limbs. And that is what I have to listen to. I don't want to know what the meaning of phantom limb is. I don't want to know the pain. I don't want to know how intense the pain is. I only want to know what this person is saying about this particular topic. So it is an expert opinion. Now, see, this clarity you should develop. Okay. Only then it becomes easier. So, what type of question this is? So, this is an expert opinion type question. So, how can you mentally prepare for yourself? Catch what Dr. Sands thinks. Okay, so here you have to think from this person's perspective. Okay, identify the belief system about phantom limb pain. Listen for phrases like, see, I think. So, I think. Okay, so for example, when someone is suggesting, okay, I think you have to go to a doctor for antibiotics. Okay, like it's hard to say. Okay, so again, they are expressing their opinions, right? Many patients we don't. Okay, so like you'll be able, like when you listen to the audio, you will know, okay, this statement over here, they are actually talking about, their opinion. So they're talking about something that is uncertainty, and they're expressing their expert judgment. So that if you listen to the audio, it becomes more clear, right? So this is the second question.